Did you know that some of the medications commonly prescribed to seniors can increase the risk of dementia? It's a fact that many people don't realize. The very pills that help manage chronic conditions could be slowly affecting your brain. Whether it's the daily medication for sleep, pain relief, or even depression, what you might not know is that some of these treatments have hidden side effects that could harm your cognitive health. Today, we're going to shed light on this often overlooked issue that affects millions of seniors. In this video, we'll dive deep into 10 medications that are widely used by seniors, yet may pose serious risks to their mental health. These medications, which are prescribed to treat conditions like anxiety, depression, and pain, could actually be making things worse in the long run. By the end of this video, you'll be informed about the medications that might be putting your cognitive health at risk, and, more importantly, what you can do about it. Stay with us until the end, because we're going to reveal the most surprising medication of all, one that many people take without even realizing the serious risks it carries for their brain health. Trust me, you won't want to miss this crucial information. It could completely change how you approach your medical treatment and the way you take care of your mind. Keep watching to find out which medication could be the most dangerous of them all. Medication 1. Benzodiazepines. Benzodiazepines, such as diazepam, Valium, and lorazepam, Ativan, are some of the most commonly prescribed medications for managing anxiety, insomnia, and stress-related disorders. These medications work by calming the central nervous system, providing quick relief for symptoms like restlessness and sleeplessness. While they are effective in the short term, especially when used for acute anxiety or short-term insomnia, there are serious concerns about their long-term use, especially in seniors. Prolonged use of benzodiazepines is linked to cognitive impairment. These medications can interfere with normal brain function, particularly memory, attention, and decision-making abilities. Seniors who take benzodiazepines regularly may experience a gradual decline in cognitive abilities, which increases their risk of developing dementia over time. In fact, the more frequently these drugs are used, the more likely they are to cause cognitive side effects that affect daily living and overall quality of life. A study conducted in France followed over 1,000 elderly individuals for 15 years and found that those who used benzodiazepines regularly had a 60% higher risk of developing dementia compared to those who did not use them. This alarming statistic underlines the importance of evaluating the necessity of long-term benzodiazepine use, particularly in older adults who are more vulnerable to its cognitive effects. Other studies have also shown that benzodiazepines can affect brain plasticity and increase the likelihood of brain atrophy, further supporting the association between these medications and cognitive decline. While benzodiazepines may be helpful for short-term relief, there are safer, non-addictive alternatives for managing anxiety and insomnia. One of the most effective alternatives is cognitive behavioral therapy, CBT, which has been proven to treat anxiety and insomnia without the cognitive risks associated with medication. Additionally, natural sleep aids, like melatonin or herbal teas, e.g., chamomile, can offer relief from insomnia without impairing brain function. It's important to consult with a healthcare provider before discontinuing any medication. But transitioning to these alternatives can greatly reduce the risk of cognitive decline in the long run. Medication 2. Anticholinergics. Anticholinergic medications, such as diphenhydramine, commonly found in Benadryl, and oxybutynin, used to treat urinary incontinence, are prescribed for a variety of conditions, including allergies, Parkinson's disease, and gastrointestinal disorders. These medications work by blocking acetylcholine, a neurotransmitter that plays a crucial role in memory, learning, and muscle function. While effective for managing symptoms like allergy reactions, bladder control issues, and even certain symptoms of Parkinson's, the long-term use of anticholinergics comes with serious risks, particularly when it comes to cognitive health. One of the biggest concerns with anticholinergic medications is their impact on brain function. Acetylcholine is a key neurotransmitter involved in the processes of memory and learning. When anticholinergic drugs block the action of acetylcholine, they can interfere with normal brain function, leading to memory impairment and cognitive decline. Over time, this disruption can increase the risk of dementia. The longer these medications are used, the more likely they are to cause noticeable cognitive problems. In fact, studies have shown that individuals who take these drugs regularly, especially seniors, are at a significantly higher risk of developing dementia. A major study conducted by the University of Washington followed more than 3,400 adults over 7 years and found that long-term use of anticholinergic medications resulted in a 54% increased risk of dementia. The study specifically highlighted that individuals who took high doses of anticholinergics over extended periods showed a stronger association with cognitive decline. The risks are particularly concerning for older adults, who are more sensitive to the side effects of these medications. In another study, researchers observed that those who used over-the-counter antihistamines, like diphenhydramine, regularly had noticeable cognitive impairments, further supporting the link between anticholinergic drugs and dementia. Given the significant cognitive risks associated with anticholinergics, it is important to explore safer alternatives for treating the underlying conditions. For managing allergies, nasal corticosteroids, such as fluticasone or budesonide, are a good option. These medications work directly on the nasal passages and sinuses to reduce inflammation without affecting brain function. In treating Parkinson's disease, medications like amantadine or dopamine agonists can offer relief without the cognitive side effects seen with anticholinergics. For urinary incontinence, mirabegron is an alternative that works by relaxing the bladder muscles and has fewer cognitive risks than traditional anticholinergics. Always consult with a healthcare provider to find the best treatment plan that minimizes cognitive risks while still addressing your health concerns. Medication 3. Tricyclic Antidepressants. Tricyclic antidepressants, TCAs, such as amitriptyline and imipramine, are commonly prescribed to treat depression, chronic pain, and sometimes anxiety or sleep disorders. These medications work by increasing the levels of certain neurotransmitters, like serotonin and norepinephrine, in the brain, which help improve mood and reduce pain. While TCAs are effective in managing these conditions, they also have a range of side effects, one of the most concerning being their anticholinergic effects, which can negatively impact cognitive function over time. The main risk associated with long-term use of tricyclic antidepressants is their anticholinergic activity, meaning they block the neurotransmitter acetylcholine. Acetylcholine plays a critical role in memory, learning, and overall cognitive health. When TCAs block this neurotransmitter, it can lead to cognitive decline, memory problems, and difficulty concentrating. This cognitive impact is especially concerning for older adults, who may already be vulnerable to age-related cognitive changes. Prolonged use of TCAs has been linked to an increased risk of dementia, as these medications can interfere with the brain's normal function over time. In addition to memory issues, the anticholinergic effects of TCAs can also lead to other unpleasant side effects, such as dry mouth, blurred vision, constipation, and urinary retention, all of which can further complicate a senior's ability to manage their health. A significant study conducted by Indiana University analyzed data from over 400,000 patients and found a clear connection between the long-term use of tricyclic antidepressants and an increased risk of dementia. The study showed that individuals who use these medications for extended periods, especially at high doses, had a much higher likelihood of developing cognitive decline. The researchers found that the anticholinergic effects of these drugs were directly contributing to this heightened risk, with long-term users showing more severe cognitive impairment compared to those who used alternative treatments for depression and pain. In particular, the study revealed that the risks were amplified for older adults who had already begun to experience mild cognitive changes. These findings underscore the importance of reconsidering the long-term use of tricyclic antidepressants, especially when safer alternatives are available. For those dealing with depression and chronic pain, there are several safer alternatives to tricyclic antidepressants that do not carry the same risks for cognitive decline. SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, and sertraline, Zoloft, are often preferred because they have fewer anticholinergic effects and are generally safer for seniors. SSRIs work by increasing the levels of serotonin in the brain, which helps improve mood and reduce pain without significantly affecting memory or cognitive function. Additionally, for chronic pain management, SNRIs, serotonin norepinephrine reuptake inhibitors, like duloxetine, Cymbalta, can provide relief without the same cognitive side effects associated with tricyclic antidepressants. It's important to work closely with a healthcare provider when switching medications, as adjusting dosage and monitoring side effects is crucial to ensure continued effectiveness and minimize potential risks. Medication 4. Statins. Statins, such as atorvastatin and simvastatin, are among the most commonly prescribed medications for lowering cholesterol and preventing heart disease. These medications work by blocking an enzyme in the liver that is involved in cholesterol production, thereby reducing overall cholesterol levels in the bloodstream. By lowering cholesterol, statins help prevent cardiovascular issues such as heart attacks and strokes, making them an essential treatment for individuals with high cholesterol or a history of heart disease. However, despite their effectiveness in promoting heart health, there are growing concerns about the impact of statins on cognitive function, particularly with long-term use. While statins are known for their benefits in managing heart disease, some studies suggest that they may negatively affect brain function, leading to memory problems and an increased risk of dementia. The potential mechanism behind this involves the role that cholesterol plays in brain health. Cholesterol is crucial for the maintenance of cell membranes in the brain and is involved in the production of neurotransmitters. By lowering cholesterol levels, statins may interfere with these processes, leading to cognitive issues. Although not all individuals who take statins will experience cognitive decline, prolonged use may result in memory lapses, difficulty concentrating, and in some cases, a more significant impact on cognitive health. Additionally, some research indicates that statins could reduce the production of coenzyme Q10, CoQ10, an antioxidant that is essential for energy production in brain cells. Low levels of CoQ10 may further contribute to cognitive decline, particularly in older adults who are more susceptible to the side effects of medications. Research on the relationship between statins and dementia has produced mixed results. Some studies suggest a potential protective effect of statins on cognitive health, particularly in individuals at high risk for Alzheimer's disease, while others point to a possible link between long-term statin use and cognitive impairment. For instance, a study published in the Journal of Lipid Research found that prolonged use of statins was associated with a higher incidence of dementia in some patients. On the other hand, other studies have shown that the reduction in cardiovascular events due to statins may outweigh the potential cognitive risks. A meta-analysis of multiple clinical trials found no definitive proof that statins increase the risk of dementia, but some studies highlighted the cognitive side effects in older patients, especially those with pre-existing cognitive decline. These mixed results suggest that while statins are effective for heart health, their impact on brain function requires further investigation. For individuals concerned about the potential cognitive effects of statins, lifestyle changes can be a highly effective alternative for managing cholesterol levels and maintaining heart health. Dietary changes, such as increasing the intake of healthy fats, e.g., omega-3 fatty acids, and fiber-rich foods, can help reduce cholesterol without the need for medication. Exercise is also a powerful tool for managing cholesterol and improving cardiovascular health. Regular physical activity helps raise good cholesterol, HDL, levels while lowering bad cholesterol, LDL, and triglycerides. In some cases, plant-based cholesterol-lowering medications, such as plant sterols and red yeast rice, may be considered as safer alternatives to statins. However, it is important to consult with a healthcare provider before making any significant changes to medication or lifestyle to ensure that cholesterol levels are effectively controlled without compromising cognitive function. Are you enjoying this video and finding it helpful? If so, please take a moment to comment, like, and share it with others who may benefit from this important information. Don't forget to subscribe to the channel to support us and help others discover the valuable content we provide. Your engagement helps us continue to create more informative videos for you and the community. Thank you for your support. Continuing from what we've discussed so far, it's clear that the medications we rely on daily for various health concerns could have unintended effects on our cognitive health. Now, let's explore another common medication that many people take without realizing its potential impact on memory and overall brain function. Medication 5. Opioid painkillers. Opioid painkillers, such as morphine and oxycodone, are often prescribed to manage severe pain, especially after surgeries, injuries, or for chronic conditions like cancer or arthritis. These medications work by binding to specific receptors in the brain and spinal cord, blocking pain signals and providing significant relief. While opioids are highly effective at controlling pain, their long-term use comes with serious risks that extend beyond physical dependence, especially in regard to cognitive health. Chronic use of opioid painkillers can have a profound impact on the brain, potentially altering brain structure and impairing cognitive function. Research shows that opioids can reduce gray matter volume in areas of the brain that are responsible for memory, decision-making, and emotional regulation. Over time, this can lead to memory problems, difficulty concentrating, and other cognitive issues. The sedative effects of opioids also contribute to mental fog, making it harder for users to focus and engage in daily activities. Additionally, long-term opioid use has been associated with an increased risk of dementia, particularly in older adults, who may already be vulnerable to cognitive decline. Several studies have shown a significant link between prolonged opioid use and cognitive impairment. A study published in the Annals of Internal Medicine followed patients who used opioids for extended periods and found that they were significantly more likely to experience cognitive decline. The researchers noted that chronic opioid users had a higher risk of developing dementia compared to those who used opioids for shorter periods or not at all. The study suggested that opioids might affect the brain's neuroplasticity, making it harder for the brain to repair itself and function optimally over time. These findings underline the importance of carefully evaluating the need for opioid use, especially for seniors who may already face age-related cognitive challenges. For those suffering from chronic pain, there are several non-pharmacological pain management strategies that can reduce the need for opioids and lower the risk to cognitive health. Physical therapy can help improve mobility and strength, often alleviating pain associated with musculoskeletal issues. Acupuncture is another proven treatment for pain relief that does not carry the cognitive risks associated with opioid use. Additionally, techniques like mindfulness meditation, cognitive behavioral therapy, CBT, and yoga have been shown to help manage chronic pain without the side effects of opioids. For pain relief in more severe cases, non-addictive medications such as acetaminophen or NSAIDs may be used with fewer cognitive risks. It's important to work closely with healthcare providers to explore these alternatives, ensuring pain management without compromising mental health. Medication 6. Anti-epileptics. Anti-epileptic medications, such as valproic acid and phenytoin, are primarily used to control seizures in patients with epilepsy or other neurological conditions. These medications work by stabilizing the electrical activity in the brain, preventing the sudden surges that lead to seizures. While highly effective in controlling seizure episodes, anti-epileptics have been linked to a range of side effects, particularly when used for prolonged periods. One of the most concerning effects is their impact on cognitive health, which is especially important for seniors. Long-term use of anti-epileptic medications can have a negative impact on memory, learning, and other cognitive abilities. These medications can interfere with the brain's normal function, particularly by affecting neurotransmitter activity. This interference can result in memory problems, difficulty concentrating, and general cognitive deterioration. Many patients who use anti-epileptics for extended periods report experiencing mental fog or reduced mental clarity, which can affect daily life. In elderly patients, the cognitive impact of these drugs can be more pronounced, potentially leading to a higher risk of dementia. This makes it critical to regularly evaluate the long-term use of these medications, especially in older adults who may already be dealing with age-related cognitive decline. Research has shown a clear link between prolonged use of anti-epileptics and cognitive impairment. A study published in Neurology analyzed data from epilepsy patients over several years and found that long-term use of anti-epileptic drugs was associated with significant cognitive decline, especially when higher doses were involved. The study highlighted that patients who had been on anti-epileptics for over a decade showed noticeable memory deficits and slower processing speeds compared to those who had used the drugs for shorter periods. Another study from Johns Hopkins University found that cognitive problems were more severe in patients who took older anti-epileptic drugs, such as phenytoin, compared to those who were using newer medications. These findings emphasize the need for healthcare providers to carefully monitor the cognitive effects of anti-epileptics and consider alternative treatments when possible. Newer anti-epileptic drugs, such as levetiracetam and lamotrigine, have been shown to have fewer cognitive side effects than older medications like valproic acid and phenytoin. These newer drugs are often better tolerated by the brain and carry a lower risk of impairing memory and cognitive function. Additionally, combining anti-epileptic drugs with non-pharmacological treatments, such as biofeedback, cognitive behavioral therapy, CBT, and dietary changes, can help reduce reliance on medications and minimize cognitive risks. If you or a loved one is using anti-epileptics for long-term seizure management, it is essential to discuss with your doctor the possibility of switching to newer medications or exploring adjunctive treatments that can provide better cognitive outcomes. Medication 7. H2 receptor blockers. H2 receptor blockers, such as ranitidine, Zantac, and famotidine Pepcid, are commonly prescribed to treat acid reflux and peptic ulcers by reducing the amount of acid produced in the stomach. These medications provide relief from symptoms like heartburn and indigestion by blocking histamine receptors in the stomach lining. While they are effective in managing gastrointestinal issues, long-term use of H2 blockers has raised concerns about their potential impact on cognitive health. One of the key risks associated with prolonged use of H2 receptor blockers is nutrient malabsorption, particularly the reduced absorption of vitamin B12 and magnesium, both of which are crucial for brain health. Vitamin B12 deficiency, in particular, is known to cause memory problems, confusion, and even more severe cognitive impairments if left untreated. When stomach acid production is suppressed for long periods, it can hinder the body's ability to absorb these essential nutrients, increasing the risk of cognitive decline. Over time, this deficiency may contribute to the development of dementia or accelerate cognitive deterioration in older adults. Research has shown a connection between long-term use of H2 blockers and an increased risk of dementia. A study published in the Journal of the American Geriatric Society followed elderly individuals who used H2 blockers regularly and found that these patients had a significantly higher risk of developing dementia compared to those who did not use these medications. The researchers suggested that the suppression of stomach acid and resulting nutrient deficiencies, especially vitamin B12, played a role in this increased risk. This research highlights the importance of carefully considering the long-term use of H2 blockers, particularly in older adults, and the potential cognitive consequences. For managing acid reflux and peptic ulcers, proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are often recommended as safer alternatives to H2 blockers. PPIs reduce stomach acid more effectively and are associated with fewer long-term risks of nutrient malabsorption. Additionally, lifestyle changes such as avoiding trigger foods, eating smaller meals, and losing weight can significantly reduce acid reflux symptoms without the need for medication. For some individuals, dietary modifications and the use of antacids can provide relief while avoiding the cognitive risks associated with H2 blockers. As always, it is essential to consult with a healthcare provider before switching medications or making significant lifestyle changes. Medication 8. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, are commonly prescribed to treat gastric conditions like acid reflux and peptic ulcers. They work by reducing the amount of stomach acid produced, helping to alleviate symptoms and prevent damage to the esophagus and stomach lining. While PPIs are effective for managing acid-related issues, long-term use has been associated with nutrient malabsorption, particularly of vitamin B12 and magnesium. These nutrients are essential for brain function, and deficiencies can lead to cognitive problems like memory loss and confusion. Over time, this can increase the risk of cognitive decline and dementia, particularly in older adults. Studies have shown a potential link between long-term PPI use and cognitive decline. One study found that elderly patients who used PPIs for extended periods had a higher risk of developing dementia compared to non-users. The malabsorption of essential nutrients due to suppressed stomach acid is believed to contribute to this increased risk. For managing acid reflux, dietary changes such as avoiding trigger foods, smaller meals, and weight management can significantly help reduce symptoms. Additionally, less potent antacids or H2 blockers can be alternatives to PPIs with fewer long-term risks. Always consult with a healthcare provider before making changes to medication or diet. Medication 9. Antipsychotics. Antipsychotic medications, such as haloperidol and risperidone, are prescribed to treat severe mental health disorders, including schizophrenia, bipolar disorder, and severe depression. These medications work by altering the effects of neurotransmitters in the brain, helping to control symptoms like hallucinations, delusions, and extreme mood swings. Prolonged use of antipsychotics has been associated with cognitive deterioration, including memory problems and difficulty concentrating. In older adults, especially those with dementia or other cognitive impairments, these medications can worsen cognitive decline. There is an increased risk of dementia in patients who take antipsychotics for extended periods, making it critical to weigh the benefits and risks of long-term use. Studies have shown that antipsychotics can have significant adverse effects on brain health. Research published in the British Medical Journal highlighted that elderly patients treated with antipsychotics had an increased risk of cognitive decline and dementia. Additionally, these medications can cause other severe side effects, such as sedation, tremors, and weight gain, which can complicate the overall treatment process. For individuals needing long-term care for mental health conditions, non-pharmacological treatments such as therapy, cognitive behavioral therapy, CBT, and psychoeducation can be effective alternatives to medication. Additionally, there are antipsychotic medications with fewer cognitive side effects, such as aripiprazole and quetiapine, that may be considered under a doctor's supervision. Medication 10. Hormonal contraceptives. Hormonal contraceptives, such as combined oral contraceptives, are commonly used for birth control and to treat menstrual issues like irregular periods or severe cramps. These contraceptives work by altering hormone levels in the body, primarily through the combination of estrogen and progestin, to prevent ovulation and regulate menstrual cycles. Prolonged use of hormonal contraceptives has been linked to cognitive decline, particularly in women over time. The alteration of hormone levels is believed to affect brain function, as estrogen and progesterone play important roles in neuroprotection and memory. These hormonal changes may impact cognitive abilities, such as memory, attention, and overall mental clarity. As a result, long-term use of hormonal contraceptives may potentially increase the risk of cognitive decline and affect a woman's brain function. Research has suggested a potential link between long-term use of hormonal contraceptives and cognitive decline. A study published in the Journal of Women's Health found that women who used combined oral contraceptives for extended periods experienced a slight decrease in cognitive function. While the evidence is not yet conclusive, these findings highlight the need for further research to understand the full effects of hormonal contraceptives on the brain. This is particularly important for women who are using these medications for many years and are concerned about their cognitive health. For those concerned about the cognitive risks associated with hormonal contraceptives, non-hormonal birth control methods such as IUDs, intrauterine devices, or barrier methods like condoms may be safer alternatives. These methods do not alter hormone levels and therefore do not carry the same potential cognitive risks. Additionally, discussing options with a healthcare provider can help ensure the most appropriate and effective birth control method is chosen without compromising brain health. In this video, we've explored 10 commonly prescribed medications that, despite being essential for managing various health conditions, could potentially pose risks to cognitive health. From benzodiazepines and anticholinergics to opioid painkillers and hormonal contraceptives, each medication has been linked to cognitive decline, memory problems, and even an increased risk of dementia with long-term use. It's important to be aware of these risks, especially for seniors, as cognitive health is something we should all prioritize. If you or someone you know is taking any of these medications, it's essential to consult with a healthcare provider about potential safer alternatives. Your doctor can help you explore other treatment options that carry fewer cognitive risks, ensuring that you receive the best care while protecting your brain health. Remember, it's always important to ask questions and stay informed about the medications you're using. Your cognitive health is just as important as any physical condition, and staying informed about the medications you're taking is key to maintaining it. By working closely with your healthcare provider and exploring alternatives, you can ensure that your treatment plan supports both your physical and mental well-being. Protect your mind, and make sure you're on the best path to a healthier future.